So this little guy just finished with his wound care stretches. Now we're gonna do some oral stretches. Basically, they're meant to help release the tension that he may be still experiencing in his face, just because when he was feeding, he was not using his tongue correctly. So we're no longer doing the traditional wound care stretch because now it's about a massage. So with the baby, you want to get them to move their tongue laterally. So you can either rub your finger along the gum line here to get him to move, or if you put your finger far enough back, he'll kind of chomp on it and you can see him moving his tongue here. And this is going to help him with his lateral movement, and then you can go on the other side. Depending on how old your baby is, will depend on how well they respond to this too. If he gets gaggy, you pull out. You don't want this to be traumatizing. The other thing that you can do is find one of these exercises that he enjoys the most. He likes the little fishy ones, and these are helpful to help him flange out his lips when he's feeding. He's a wiggly butt, wiggly wiggly. And then we're gonna do some cheek stretches because he's got built up a lot of tension in his cheeks just from using his mouth incorrectly. And we're gonna go to 3 points. We're gonna go from the corner here to the middle of the ear here, and then to the lower part. And I'm gonna come from the inside and I'm gonna stretch. And it's not a hard stretch, it's a gentle one. So it's like this, and you pop out. I know. And then this, and if he gets fussy, go back into one of those ones he likes. You can massage the outside. Hi. Yeah, you gonna talk to me? You can massage the outside. Timing is everything. So I'm gonna go into this one. And you'll be able to feel the tension when you're doing it yourself in their mouths. Yeah, good job. And then he also has a high palate. So we want to get that palate. We're going to put our fingers together here, and we're going to lift up on the palate and then out. It's not, none of these are hard. The babies are pretty malleable. So I'm going to ask for permission just by tapping and get him to open his mouth. And then I'm going to come in and out. Come in and out. So I'm going, it's like a wiper blade. So I'm coming together and then out. And the idea is to get that high palate to kind of drop down. Okay. And then we can go back into some lip stretches. I know. And right now I'm just kind of getting him to relax. I'm not asking anything from him right now. I'm just kind of, yeah, kind of moving and stimulating. And then when I get a chance, I'm just going to kind of stretch these lips. No. And then you get out. You don't want to upset them. So you just move from one to the next, not spending a lot of time. There's no pain here involved. It's mostly just, he just got done with the wound care stretches. So he's still like, are you going to stretch me? Is this going to be painful? But you're going to do this a few times a day. Okay? That's it. Good job. Good job. Yeah. Yeah. I know.